Syria's civil war has destroyed much of that country's health system. The result is that many children die of injuries that could ordinarily be treated if they could get to a functioning hospital. In addition, polio and other diseases are beginning to make a comeback since millions of Syrian children are no longer being vaccinated.
What we found in researching this report is that because the health system has been so devastated by the 3 years of the conflict, it's not just bullets and bombs and injuries that are killing children, it's lack of access to even the most basic health care. So what that means is a resurgence in some vaccine preventable diseases. So one example is that before the conflict started, there was 91% coverage in vaccinations across the country. And as that's broken down, we've seen, for example, polio, which had been eradicated in Syria. We've seen cases of that, measles, meningitis, things like that.
The charity Save the Children says across Syria, 60% of hospitals have been damaged or destroyed, and half the country's doctors have fled. In addition, 93% of ambulances have been destroyed or stolen.
What we're seeing is that hospitals and clinics just aren't able to deliver. I mean, Aleppo used to have 5,000 doctors, now it has 36. So really, how can children get the kind of care that they're used to? There are no supplies. So, for example, we're seeing that children are, instead of being able to get sterilized bandages, doctors are using old t-shirts, for example, to cleanse their wounds. Car batteries are being used to run electricity to perform operations. There's no anesthesia. So in every sense of the word, from the lack of doctors to the lack of supplies, children's health is in danger.
What are people doing, for example, for the lack of anesthesia when they need an operation?
Well, as you can imagine, that's a really scary situation for a child. And we've heard everything from operating without anesthesia to finding other really unpleasant ways to make people unconscious, including even hitting them on the head to make them unconscious. And you can imagine what the secondary effects of something like that might be.
Humanitarian organizations are providing what help they can to the 2.5 million Syrians in refugee camps in neighboring countries. The pressing need now, they say, is getting access to the 5 million people inside Syria who desperately need help.
Well, I've met a lot of the children, teenagers and families who have left Syria in neighboring countries. And what I will say is that when we're able to work with those children to put them in an education, a school setting, give them the things they need, we see a huge change in their outlook and their prospects for the future. And it's our responsibility to help them maximize that potential. In terms of inside the country, what we're calling for is humanitarian access.
Humanitarian officials worry that as the war enters its 4th year with no end in sight, a whole generation of Syrian children is being sacrificed. Save the Children is hoping for some small improvements from last month's unanimous decision by the UN Security Council calling on all sides to cooperate to let in desperately needed humanitarian aid. But in the long run, not much is expected to change until Syria's devastating civil war is brought to an end. Burton Bolag, KSA2, Washington.